Good afternoon, everyone, and welcome to the Board of Pharmacies webinar today. I'm Tom Glensky, Chief Inspector with the board. The topic for today's webinar is going to be an update on pharmacist administration. Before we get started, I will go through just some general information about the webinar. All participants are in listen-only mode. If you have any audio issues via your computer, you can use the telephone option. If you go to your toolbar, you'll see there's dial-in instructions if you need to dial in instead of using your computer audio. This has been approved for 1 hour of CE. You must be signed in under your own name on GoToWebinar's web page. You're not allowed to share someone else's username. I'll give more CE instructions at the end of the webinar. Just a reminder to save your certificates. We do not submit CE credit to the CPE monitor. If you'd like handouts of the slides today, there's 2 places you may get those. If you go to the board's website, on the left side under upcoming events link, you will find a link to the handouts there, or you can go directly to your GoToWebinar toolbar, and under the handouts section, there should be a PDF of the slides posted there. We do record all our webinars and post them on our website. If you missed any previous webinars, you can go back and watch them there. If we have time at the end of the webinar, I will take questions from participants. If you'd like to submit a question during the webinar, go to your toolbar, type in the question and hit send, and we'll see if we can get to some of those at the end. Okay, so today's webinar, I have it broken down in different sections. First, we'll talk a little bit about the PrEP Act, since that's still in effect and does have some impact on pharmacists doing immunizations. And then we have something new, an administration by technicians. And then I'll give just a brief overview of the requirements to do administration by protocol or by prescription order. And then throughout all that, I'll be giving some compliance tips of things we find on inspection that we observe. And then we'll also talk about pharmacies wanting to use nurses to do administrations and immunizations. And then, as I said, we'll try to take some questions at the end. So we'll talk first about the PrEP Act. The PrEP Act is the federal government act that related to the pandemic. It covers 3 vaccines types, the COVID vaccines for ages 3 and above, influenza for age 3 and above, and then any CDC recommended childhood vaccine ages 3 and above. Not 3 and above, 3 to 18. The PrEP Act allows pharmacists to order and administer. It gives them the authority on their own. You don't need a standing order or protocol to do any of those vaccines under the PrEP Act. It allows interns and technicians to administer. The PrEP Act does preempt state law and regulations, and so you must be following the PrEP Act requirements. We're on the 10th Amendment to the PrEP Act now. I have a link there if you need to see that. And you need to stay, tuned for future amendments too, because some of the requirements may change throughout as we get future amendments. I'm not aware of any end date that's been announced for the PrEP Act. It's in place until we hear differently. The PrEP Act is less restrictive than some of our state requirements. As you see, the age 3 and above, currently under Missouri's protocol law, you can only do ages 7 and above. So it gives a wider range of ages there. And then it also covers other vaccines in the childhood vaccine arena that aren't currently allowed to be done by protocol in Missouri. So examples would be MMR, varicella, and HPV. And then the requirements for technicians are less stringent. They do not need to be certified in order to administer under the PrEP Act. And the training program that they're required is less specific than the board's training requirements for technicians. So when it comes to jurisdiction, it can get complicated on whose regulations, requirements should you be following. So sometimes it's just based on the vaccine itself. Others, it's the vaccine and the age of the patient. So an example would be shingles vaccine, which would be strictly under the Board of Pharmacy, since there's not a childhood recommendation for that. But when other vaccines that are also childhood vaccines, such as pneumonia and Tdap, it's all based on the age of the patient. So for the pneumonia for a 16-year-old patient, you'd follow PrEP Act requirements, but for a 67-year-old patient, you'd be under the board's jurisdiction and follow their requirements. And same example here for Tdap for a 12-year-old, it would be PrEP Act, and 22-year-olds since they're over 18 would be Board of Pharmacy. So it is kind of complicated, the PrEP Act, trying to figure out whose regulations and requirements to follow. So when it comes to the COVID-19 vaccine, Missouri, you cannot use a protocol with a physician to administer that anymore in Missouri. That went away when the COVID waivers went away at the 1st of January this year. You still have two options on how to give the COVID vaccine. You can do it under the Pharmacist Authority for the PrEP, under the PrEP Act, or the state has a statewide standing order that can be used to give the vaccine. Just a reminder, there is no state standing order for influenza or childhood vaccines. The standing order only covers the COVID-19 vaccine. If you need to make a prescription for the COVID vaccine when you're administering it, the prescriber on it will depend on where the authority is coming from. So under the PrEP Act, the pharmacist would be the actual prescriber on that prescription. Under the state standing order, it would be Dr. Turbalese, who is the physician on the state standing order, would be the prescriber. So some of the compliance issues we've seen related to the COVID-19 vaccine it has to do with, we have some examples here of the product itself and then some with the records. We see vaccine with no beyond use date or beyond use time. This could be frozen product that has been taken out of the freezer with no expiration date on when it would expire, and now it's out of the freezer. Or we see punctured vials that have no beyond use time on them on when they would expire since they've been punctured. We've also come across some unlabeled syringes where people have pre-drawn syringes with no label at all indicating what the product was, let alone a beyond use date or lot number, anything like that. Other times we find them drawn, but they don't have all the information on there that's required. Lack of distribution records. We know some pharmacies are acting as hubs for the distribution of COVID-19 vaccine. It's still a distribution that you would need a record. So if you're a hub and you're sending it out to other pharmacies, you need to make sure you're keeping a record of where that product's going. And then the receiver on that other end also needs a record on their end of what they received and where they received it from. And then the federal government and the state does require when the COVID vaccine is being transported. So if you're a hub and you're sending it somewhere else, when it's being transported, you're still required to be tracking temperature. And so we're finding people who are not doing that, or at least not documenting that they're doing that. And then incorrect prescriber on prescriptions, as I mentioned earlier, it's all based on whether it's where the authority is coming from, whether it would be the pharmacist or Dr. Turbalese on the prescription. We'll move on now to administration by technicians. That's something new in the last year. The board amended both rules by prescription order and by protocol Last year, they did it through emergency rulemaking, which have now become permanent rules. And it allows the delegation of by a pharmacist to a qualified technician. In the past, it was just you could delegate it to an intern pharmacist. So now technicians are allowed to administer. There is no waiver needed for this. As I said, these are permanent revisions to the rule. When the COVID waivers went away in January, at the end of December, this did not affect this. Technicians can still administer. Now, when they're administering, there must be under the supervision of a pharmacist, and that pharmacist must meet the same rule qualification requirements in order to supervise. So we've been asked before, if a relief pharmacist comes in who does not do immunizations, never done them, has not been qualified, can they supervise technicians? And the answer is no. The pharmacist that is supervising must meet all the requirements of the rule for pharmacists to immunize. The pharmacist be present and on site. There can be no remote supervision when technicians are doing the administration. And the pharmacist must first approve the administration before it's delegated. So the technician is not the one out there making the decision on if the patient qualifies or not to receive the vaccine. The pharmacist needs to be the one that makes that determination, and then they can delegate the actual administration process to the technician. And the vaccine administration records need to include both the pharmacist and the supervising pharmacist and the technician who gave the administration in the record. So both need to be done there. We have some issues with some software. Maybe this have a place for one identity. You need to come up with another way to track if it can't track both of them. So to be a qualified technician, there's 3 requirements to be that. First, the technician has to hold an active technician certification from a national certifying body. They have to complete initial and ongoing documented assessment of competency. That's the pharmacy's own competency assessment. That's not the initial program that they're doing to get trained. So this is something that the pharmacy has to create and do themselves. And then to be able to be a qualified technician, they have to have at least 1 year experience working as a technician in Missouri or another state in order to do that. So if they meet those 3 things, then they would be qualified. And then the other requirements would be they need to complete a administration training program, just like pharmacists do. Same requirements apply to the program that applies to pharmacists. And then they must have either a current CPR or BLS certification. So some of the issues we found with technicians doing immunizations is unable to locate their proof of training program or unable to locate their CPR, BLS certification. Sometimes we've actually, they actually, especially when it comes to CPR and BLS, the pharmacy didn't actually have a copy of it. The technician had to retrieve it off their phone somewhere before that. So the pharmacy needs to be able to produce those on an inspection if it has. As I mentioned earlier, the vaccine administration record needs to identify the supervising pharmacist. It's not just the technician who did it. That also applies to interns. When an intern is giving an administration, you need to document who the supervising pharmacist was. And then we've had issues with technicians and counseling patients during the process. Example would be we've heard technicians give advice on how to treat adverse reactions or side effects to immunizations and stuff like that. So again, remind technicians that any questions they get from the patients need to be directed to the pharmacist to answer. So we'll move on now and do just a brief refresher on the requirements for pharmacists to administer by protocol. So the protocol has to be with a Missouri licensed physician who's actively practicing. There no longer is a mileage restriction that was taken out a few years ago. One physician could cover the whole state now. For pharmacies that are spread out throughout the state, they don't have to get multiple physicians. Now they can just use one if they choose, since we don't have the mileage restriction. The statute allows pharmacists to do these 8 vaccines listed here, and it also includes combinations of them too, such as the Tdap. And then the statute limits immunizations to age 7 or above, and it also requires compliance with CDC guidelines whenever you're providing a vaccine. So the pharmacist requirements, they must complete an administration training program and certificate program. They must have a CPR or BLS certification, and then they must file a notification of intent, or as we call it, an NOI. So if they've never immunized before, they're right out of school and need to do this, you go online and submit an NOI on our online page that allows you to do that. On the left side of our website is a link, I think it's called Online Services or something like that, that if you click that, you'll find this is one of those online services. So for new ones, that's how you submit a notification of intent. If you already have one, you renew it now when you renew your pharmacist renewal. So every 2 years, you will be renewing it, and it's part of the renewal process. So it's built in there. And then you are required when you renew to have 2 hours of CE related to immunizations or administration in order to renew that NOI. Pharmacists, under the protocol rule, may delegate to interns or qualified technicians. So for interns, they have to also go through a similar training program as pharmacists and also have the CPR BLS certificate. And then for the technicians, I'm not going to repeat it, but it's the same requirements of above, the 3 to be qualified and the 2 additional requirements that I mentioned earlier. And then there is no NOI requirement for interns or technicians. They are not required to submit an NOI. So the protocol itself, I'm not going to go through the list of items that must be in it. You can find that in some of our resources that I'll talk about at the end of the program, but it does need to be signed and dated by all parties. So that's the physician and all the pharmacists. And signing and dating also applies to any amendments that are done to it. Protocols have to be renewed yearly. They no longer need to list pharmacy locations. The rule was changed to you no longer need to list what pharmacies you'll be administering at. And also there's no need to list non-pharmacy location if your protocol states you're allowed to go off-site. So that's another one that, especially during the pandemic, we had lots of places come up. Pharmacies say, we need to add something real quick due to a pandemic issue. Do we have to go get an amendment from the physician? Back then you did. Now you would not need to. If you can change your protocol to state it's allowed that you go off-site, then you don't need to specifically list any non-pharmacy locations. And another change that was made was the protocol can now dictate if the physician wants notifications. This is the protocol physician. So if the protocol physician does not want to be notified every time you provide an immunization, then all you have to do is somehow say that in your protocol. And then interns and technicians do not need to sign protocols. We get asked that occasionally. So no, similar to NOIs, they're not required. And then the protocol must be kept for 8 years. This is, 8 years is out of the norm for Board of Pharmacy records. It's actually came over from the Board of Healing Arts on what they require for protocols. So 8 years for that. For other records, it's 2 years, except prescription records would be 5 years. So if you're doing it by protocol and have an adverse reaction, you are required to report it to the protocol physician, and if the patient has a primary care provider, to them also, and do that within 24 hours. You must also report any vaccine adverse reactions to the VAERS program within 30 days. And then you're required to report all immunizations to the Show Me Vax. That's the state reporting site database, unless the patient opts out. And if the patient opts out of reporting, then you still must report to their PCP if they have one, and do that within 14 days. And then you must create a prescription for any vaccine that you give, and do that within 72 hours. And again, the protocol physician would be the prescriber on that one. You're required to have a vaccine administration record, or a VAR. This is separate from the prescription that you create. And this record requires you to have the information listed here on there. I'm not going to go through all of it, but it's pretty general information that you gather from either the patient, or once you give the vaccine, information about what vaccine you gave. So some of the compliance issues we find related to protocols is pharmacists unable to produce the protocol. It's misplaced, or sometimes it's electronic, and they don't know how to retrieve it electronically from wherever it's stored. We see protocol and amendments not signed and dated by all parties. We see pharmacists administering on expired protocols. So I would highly recommend you set some kind of reminder to when your protocol expires, so you don't run into that issue. Failure to follow the protocol, a prime example is not requesting the patient stay around for 15 minutes or whatever the protocol says to be observed. Incomplete or inaccurate VARs is a common issue. Failure to notify the protocol physician or the PCP of an adverse reaction, or if they did do it, they don't document it. So those are related to adverse reactions. And then incorrect prescriber on the prescription. When you're doing it by protocol, it will always be the protocol physician who is the prescriber. It's not the PCP, and it's not the pharmacist. I'll also tell you about some of the public complaints we received. Up until a few years ago, when asked, I would say we rarely got any complaints related to immunization. We occasionally got a side effect complaint, or a complaint about the vaccine was given too high in the arm that caused some problems. But other than that, we really didn't have much complaint activity related to immunizations. But in the last 2 years during the pandemic, we've actually seen quite a few. They range from a variety of things. Incorrect vaccine given. We've had people come in for a flu shot that ends up getting a COVID vaccine, or vice versa. Sometimes it's just a breakdown, and whoever was doing the immunization didn't follow procedures of verifying the patient, who they were or what they were there for. It seems they find out after it was given that it was that's not what the patient was there for. So following your procedures should help minimize that. Incorrect dose given. With all the various COVID vaccine dosing out there, you've seen the wrong dose given to patients. We've also seen patients who didn't qualify, so they were under the age, get vaccines, or got the wrong vaccine for that age group. We've had issues with vaccines not being reconstituted properly, and this goes back again to the COVID vaccines that need to be reconstituted. A vial was not reconstituted right, and then was administered out of that, affecting all the patients that got that vial. We've had a couple complaints related to did the pharmacy have proper consent in order to do minors, which is we hadn't had that before, so that's come up a couple times in the last couple years now. And then Mo HealthNet has also been providing information to us. They glean their billing data that's submitted and look for issues. They actually, some of them that have uncovered the wrong people getting in the wrong age group getting the wrong vaccine. So this is, again, in the past we haven't seen this, but due to the pandemic, I think a lot of this is related to pandemic activities. So I'm going to move on now to administration by prescription order. This rule allows pharmacists to administer any drug or vaccine that's prescribed by a healthcare practitioner. The prescriptions need to have the route of administration on it, and if there's a dosing schedule, if more than one dose is to be given, then it needs to have a schedule. Other than that, it doesn't need to, it's pretty much the same as any other prescription requirement, but we no longer require the statement on there to be, it can be administered by a pharmacist. That's no longer required, so you don't need to be calling and getting clarifying prescriptions and adding that to it. There is no age restriction in general by this rule. You can immunize or give any vaccine or any drug with no age restrictions. However, when it comes to vaccines, you must be following CDC or manufacturer guidelines. So there would be age restrictions on some of the vaccines, but for drugs, there isn't any. And then for vaccines, you must report to Show Me Vax, just like under protocol. If the patient opts out, then you must notify the PCP within 14 days if they have one. So pharmacist requirements are similar to protocol, administration training program, CPR, BLS, and then the notification of intent. However, on this one, there is no CE requirement when you renew it. And I do need to stress there are two different NOIs. If you're going to do it by both protocol and prescription order, there's an NOI for each form, each process. So you may be submitting two NOIs. Sometimes people get confused and said, oh, I submitted one, didn't realize they needed one for the other process too. So. And then for pharmacists who want to do routes other than in their original training program, and I think almost all pharmacists' original training program was the immunization. They were taught how to do IM and sub-Q. If you want to do a route other than that, the rule now allows that. You have to be trained by a licensed healthcare practitioner who's authorized to administer that medication by that route, and then you must document that training. So we've had some pharmacists inquire about doing some subdermal injections and also inquiry about IV type push and starting IV type things. So it is allowed now. You still have to go through the initial training and meet all the other requirements, but you can add other routes under this method. So again, similar to by protocol, you may delegate to interns and authorized technicians. The same thing applies, as I mentioned earlier, training programs, BLS or CPR for the interns, and then authorized technicians, the same requirements would apply to them. And then again, there's no NOI requirement for interns or technicians. So if you're going to do administer by prescription order, you must have a policy and procedure manual. It must cover all aspects of the administration process. It's not the same document as your protocol. Now, it may contain contains some of the same things as your protocol, but they are two different documents. You can't hand us your protocol and say, here's my policy and procedure manual. Again, now some of it, like how you treat an adverse reaction, how you screen patients, may be the exact same thing, but you have to create two documents here. The VAR is that's required for administration by prescription order is the same as that VAR requirements by protocol. If you have any adverse reactions to any drugs or vaccines given by this method, you must notify the prescriber within 24 hours. If it's a vaccine adverse reaction, you must report it to the VAERS program within 30 days. Some of the compliance issues we've seen related by prescription order include prescription missing the required elements. It's probably most likely the routes not on there, or the dosing schedule if it requires one. Incomplete VAR or inaccurate. And then failure to have policies and procedures manual or unable to locate them. Again, electronic, we allow them to be electronic, but you need to be able to pull them up and find them during an inspection. And then the policy and procedure manual might be incomplete. It doesn't cover all the topics needed. Another one would be not following your policy and procedures manual. And again, an example of that would be not asking the patients to stay around to be observed. So we'll move on now to using nurses in pharmacies to do immunizations and administrations. The board has always been, from day one, when pharmacists got the authority to do administrations, we were questioned, can we just hire a nurse to do it for us? And prior to the pandemic, there really wasn't an avenue for that. But during the pandemic, some things changed. So if you want to use nurses, you must first determine what authority are they using in order for them to give immunization or administer a drug. So the two options would be it's being delegated by a pharmacist who has a pharmacist protocol. But in order for them to delegate it, pharmacists, they can't delegate it just to a nurse. It has to be a technician. So under this method, the nurse would be functioning as a technician, not a nurse. The nurse would have to follow all Board of Pharmacy requirements. That includes licensure as a tech, being certified 1 year experience, and go through a pharmacist training program. So that's the one if you're going to just delegate it off your own protocol. The other option would be the nurse uses her own authority, and nurse might have a protocol or a standing order, or if it's a mid-level practitioner, they would have their own independent authority. So if they're doing that, they're not functioning as a technician, and they may follow the board's guidance on how that can be done. So we'll go over the guidance now. The board originally issued this during the pandemic, and it just covered COVID vaccine. And then later on, it was extended to allow it for any vaccine or any drug being administered in the pharmacy by a nurse or other healthcare provider. And so on an e-alert back in December, the board issued this. It's really small here, so we're going to go over it in here. So the first requirement is, if you want to do this, they have to have their own authority coming from their own protocol or standing order. Or as I said, if they're a mid-level practitioner, they would have their own authority. And they have to be in compliance with their board's regulatory requirements. And then they have to follow the screening requirements. They're the one that's going to be doing the screening of the patient and stuff. So they're going to follow either their standing order or protocol when it comes to that. And then the pharmacy, you can use your computer software to conduct billing or vaccine reporting for the administrations they give. If you do need to create a prescription number, we will allow that. However, the computer record or any hard copy generated or an image of a hard copy needs to clearly indicate this is a billing record and it's not a prescription. You're not creating a prescription here. We're allowing you to use your system to do billing or vaccine reporting. The pharmacy must be able to account for if it's the pharmacy's vaccine, then they have to be able to account for it. So you're either going to do that via billing records or distribution records where you're distributing it to that healthcare practitioner. But we will also allow you to just say, pull up your billing records and pull it out of there on what of your inventory they used. If a hard copy vaccine administration record is generated and you're going to store it at the pharmacy, they need to be stored separately from any pharmacy administration records. So if you have a nurse doing it under this method, they're going to have their own file of VARs, and then the ones pharmacists are doing, they'll have their own file. So we do require you to separate the records because it's two different processes here. And then we clarify that the healthcare provider does not need to be registered as a technician to do this, except if they have independent access to the drug inventory, and that would mean they're able to come into the pharmacy without staff present and access drugs, or even just be in the pharmacy where drugs are stored. They don't even have to access and just have access to them. So under that scenario, if they do come in without any kind of supervision, then they would have to be a technician. And then we do have a disclaimer on here that we have not reviewed this for insurance billing or liability concerns. The board does not give guidance on how to do proper billing. You would need to inquire elsewhere on how a pharmacy can bill for something a nurse does. Then we've been asked about, does my pharmacy liability cover if a nurse is in here? That's a question to ask your pharmacy liability insurance company. We can't answer that for you. So if you need legal advice, we advise you to consult an attorney, and any practitioner should contact their own licensing board for what requirements they would need to be following. So some of the resources the board has related to this, we have the pharmacist, it's actually called Review of Pharmacist Immunization / Administration Checklist. This is a document we created to kind of be just a quick checklist of what you need to do in order to do this. It's a two-sided document. The one side is administration by prescription order. You turn it over, it's administration by protocol. It's very helpful. It's just quick bullets of what you need to be doing, broken down into what section you're talking about. So, and we just revised this last year to include the new technicians and some of the other changes that were made to the protocol requirements in there too. So that's on the board's website. I have a link there to it. If you've been inspected recently, the inspections folder that inspectors leave has a hard copy of this inside that folder. And then the pharmacist practice guide is sections L and M are dedicated. Each section is dedicated, one's to protocol and one is by prescription order. As the practice guide, we try to write that in more layman's terms to make it easier to understand. So that's always a great source if you have questions related to either one of those methods. Okay, so we have time now for some questions. Give me 1 minute to switch over here. And we're going to stick to questions related to the topic at hand today. So immunizations and Administration, we usually get questions totally unrelated, so we usually do not cover those on these webinars. So for when someone wants to know, can techs administer other vaccines not covered by the PrEP Act? Yes, they can cover, they can administer any vaccine that a pharmacist can do. So under protocol, or they could administer any vaccine or drug under the prescription order that a pharmacist could do. So yes, the technicians aren't limited just to the PrEP Act. Now, they have to keep in mind, they have to meet the board's requirements to be able to do it outside of the PrEP Act. And as I mentioned earlier, those requirements are different. The boards are more stringent when it comes to technicians, training and requirements to be able to do it. Someone's asking, how do I register for CE credit? You don't have to register for CE credit, just registering for the webinar gets you that, but you have to complete the post survey at the end. If you do not complete that, then you do not get the CE. Someone wants to know, are CEs allowed for technician? Yes, we grant this we'll issue a certificate to a technician. However, I can't speak to where if you're certified, if your certifying body will accept a CE from a board. You would need to check them before you rely on that. Since we are not an ACPE CE provider, you would definitely want to check with your certifying board if you're going to submit that as part of your renewal requirement. Someone wants to know, can you renew your CPR certificate by an online course only? The answer is no. The rule says the online course, any course has to include a live training component. Now, there are programs out there that are a mixture of both virtual and live, that would count, but strictly one that is just virtual with no live component would not qualify. Let's see, does a VAR have to be signed by a pharmacist? The answer is no, it doesn't need to be signed. Their example is if their name is pre-printed on there, no, as long as the identity, the initials, the name of the pharmacist or who's ever doing the immunization, or if you're the supervising pharmacist, it doesn't have to be an actual signature. It's just some kind of identity. A signature would work, but it's not required, as long as you have some other format. I'm not 100% sure I understand this question, but they want to know if your computer generates a document, can that be the prescription, or do you have to physically write up a prescription? I assume you're talking about when you need to create one based off something that was given by a protocol. You do not need to handwrite one up. If your computer will generate and it has all the requirements on there, no, that would suffice, and that could be your hard copy. And you could take an image of that if you're doing scanning. What vaccines are pharmacists able to delegate to a technician after the pharmacist had verified the product ineligibility? Well, it'd be any that a pharmacist is allowed to. So the 8, if you're doing it by protocol, it would be the 8 vaccines or combinations of those 8 that I mentioned earlier. If it's by prescription order, it would be any drug or vaccine that a pharmacist would be able to do by that. Someone's asking the CE requirement, the 2-hour CE requirement, does that have to be split 1 hour between each year, or can it be just 2 hours in that 2-year period? It's the later two, you just have to have 2 hours obtained sometime during that 2-year renewal period. Someone's asking, does Missouri require the annual blood-borne pathogen course by Osha? The board does not specifically require that, but I believe there's some other agency or somebody does require that, but I can't remember right now who that is. I can't think right offhand who it is, but yeah, I believe it is required by somebody, but it's not specifically by the board. Someone wants clarification on whose name needs to be on the vaccine administration record when it's a technician. So it's the technician who gives the immunization or administration, and then the supervising pharmacist. That may be a different pharmacist who fills a prescription that's going to be getting it. It's the supervising pharmacist if you have more than one pharmacist working there. So that would be an example. If it's being done by prescription order, some other pharmacist may have filled the prescription. But it's the supervising pharmacist needs to be on there. Someone wants to know if you're administrating the COVID vaccine under the state standing order, must the pharmacy technician be certified? The answer is no, because that is covered under the PrEP Act, and the PrEP Act does not require technicians to be certified. Someone wants to know, does today's webinar count for the 2 hours of CE to renew your ANOI? And the answer would be yes. Someone's asking to clarify again the PrEP Act versus board's rules when it comes to technicians. They want to know, can technicians only administer flu and COVID vaccines under the PrEP Act? Well, no, childhood vaccines in addition to flu and COVID are covered under the PrEP Act. Any other vaccine would be under the board's rule, except childhood vaccines. Once they're out of the age 18 range, then that would be under the board's requirements, because it's no longer a childhood vaccine. So in the example was a young adult comes in, a 22-year-old comes in for a Tdap, that would not be covered under the PrEP Act, because the patient doesn't fit the childhood vaccine range under the PrEP Act. Someone says it's confusing on what is the age limit, 3 or 7, or does it depend on the vaccine? It depends on the vaccine. It also depends on where you're getting your authority from. So the board by protocol, it's age 7. The board by prescription order, there is no age limit unless it's a vaccine that would have an age limit by CDC or the manufacturer. The PrEP Act allows you to go down to age 3 for COVID vaccine, influenza, or the childhood vaccines. So yes, it is confusing. You just need to, if you go back to my chart, kind of just plot it out on what's the vaccine and what's the age of the patient to figure out. Someone wants to know, when do we use a billing record instead of a prescription? Well, I talked about it under if you want to use a nurse or other healthcare practitioner in your pharmacy is when I was talking about it. Someone wants to know, can a technician or intern administer vaccine if the patient has Missouri Medicaid? As far as I know, they can. If you have a question specific for Medicaid, you better send that to them. I'm not aware of anything that prevents them from doing that. But again, I would send your question to Missouri Medicaid if you want clarification on that. Somebody's asking, where can I find a summary of the documents need to be retrievable for inspectors related to technician immunization? The slide from today talks about it. Other than that, I don't know if I have the checklist. Probably has it on there. And then I will verbally tell you, you need to have their training, whatever training program they did, they would have a certificate for that. So an immunization or administration training program. They're going to have either a CPR or a BLS certification card. You're going to have proof of the initial pharmacy assessment of their ability to do that, and then annual assessments going forward after the initial one. So that's another document. They have to, if there was any question on it, have they been working more than a year as a technician, that you would have to be. So if they came from another state, I guess you would maybe need to have proof that they were licensed in that state. We would know, you would tell by their license number with us that they've been licensed with us. Now, if they didn't work for you, then you might have to get something to show that if they came from somewhere else that they were working, not just that they were licensed. They have to have experience working as a technician. So those would be the things you need to have ready for an inspection if asked. Oh, forgot. And a copy of their certification document that they're a nationally certified technician would be the other. Someone wants to know, could I go through the process to administer a Abilify injection? Is that allowed? Yes, it's allowed under a prescription order. So in order to do that, you need to comply with our prescription order rule. You would get a prescription from a prescriber for the Abilify. You could then fill it, and then you would be able to administer it to the patient based on complying with our rule, what I previously talked about. A couple questions related to this is, can a patient bring in their own Abilify and have you administer it? The answer is no. You can't. They can't do that. Another scenario is if I get the Abilify from dispensed to that patient from another pharmacy, can I do it then? And the answer is yes. Now, there's two things you got to do here. There's an exemption from Class J shared services if you get a filled prescription from another pharmacy that's going to be administered within the same site, on site at the pharmacy. So that would have to come directly to the pharmacy. It can't go to the patient and then go to them bring it into the pharmacy. So they would, you would get that filled prescription, and then you're allowed to do it. But you, since you didn't fill the prescription to begin with, you would still need to get an order from a physician in order to inject that. So you would ask whoever prescribed that form to also give you some kind of order so you could administer it, because you weren't the one that actually filled the prescription. And then you would just follow our rule, all the requirements of the rule when you do that. So yes, it can be done, and there's different scenarios under it being done. And I think I just answered this. Can you administer a medication by prescription order filled at another pharmacy? I just talked about that. The answer is yes. It's not Class J, but you have to read the Class J rule, because you still need to keep a record of where you got it from and that. So if you're going to do this, you need to read the Class J rule. That's 2.650. Parens 2 of that is a section on when you receive a drug from another pharmacy that's going to be administered on site. It's when you receive a filled prescription from another pharmacy and you're going to administer it on site. It talks about there how to do that, and that it's not Class J. Someone wants to know, is there in order to keep maintain your status as an immunizer, is there a minimum number of immunizations you must do in order to do that? The board does not have any such requirement. Someone's asking if using the PrEP Act to immunize and the computer generates a pre-printed prescription for you, does a pharmacist who would be the prescriber on that need to sign it? The answer would be no. As long as the pharmacist's name on that, we could consider that electronic prescription. To clarify that question, they're also asking if when you're doing it by protocol, the pharmacist is not the prescriber whenever you're doing it by protocol. So you're not generating a prescription for the pharmacist to sign as a prescriber if you're doing it by protocol. This only applies to the PrEP Act. Okay, we are almost out of time, so I didn't get to all the questions. So sorry about that. We will move on. Upcoming webinars, we have one a month for the next 4 months. For those that are needing CE to renew your license, here's 4 hours you can get pretty easily. We're going to have a real revision update. There's major changes coming to the standards of practice and pharmacist administration and pharmacist in charge rule. Those are going to take effect at the end of August, I believe. We're going to do a webinar at the end of July to talk about those. So that's a key one people might want to do, because there are some major revisions coming to those. We'll do a legislative update in August for the legislation that will become effective, be August 28th. Any bills that got signed will become effective then. Katie Diebold, our sterile compounding inspector, will join me in September to do a sterile compounding update. And then October, we'll do our annual compliance update and extended question and answer session. I have some other inspectors here with me for that. So that's the schedule coming up. Watch for e-alerts on when you can register. As I said earlier, we do recordings of all our webinars. It can take maybe up to 15 days before they're posted. The 2 webinars we've done so far this year, we did a COVID-19 update, and then Mike Boger from BNDD was a guest and did an update for BNDD. So those are what's out there currently, plus all our previous ones. So if you want CE, You must complete the post survey. Do not close your browser. After I say I'm closing the webinar, this screen will come up and you click close on that. Again, do not close your browser, and then the survey will open. You answer the questions on there and click submit. If you do not get the survey, you can email us at compliance@pr.mo.gov and just ask us for the webinar questions. However, you must have them back to us within 24 hours by email if you want credit. And again, we will email you your certificate in approximately 30 days. We no longer mail them, so be checking your email for your certificate. So I want to thank everyone for joining the webinar today, and I'm going to close the webinar now.